Pharmacology. Respiratory introduction. Every year, millions of Americans visit their healthcare provider for respiratory diseases such as allergies, asthma, bronchitis, common cold, chronic obstructive pulmonary disease, and pneumonia. Currently, more than 25 million people in the United States have asthma. Approximately 14.8 million adults have been diagnosed with COPD, and approximately 12 million people have not yet been diagnosed. The burden of respiratory diseases affects individuals and their families, schools, workplaces, neighborhoods, cities, and states. Because the cost of the healthcare system, the burden of respiratory diseases also falls on society. It is paid for with tax dollars, higher health insurance rates, and lost productivity. Annual healthcare expenditures for asthma alone are estimated at $20.7 billion. Before we learn about medications that are used to treat respiratory conditions in our patients, let's review the respiratory system. This accounts for COVID as well. Nursing pharmacology, respiratory basics. Basic concepts related to respiratory medications. An overview of the respiratory system for respiratory pharmacology and COVID. The purpose of the respiratory system is to perform gas exchange. Pulmonary ventilation provides air to the alveoli for this gas exchange process. At the respiratory membrane, where the alveolar and capillary walls meet, gases move across the membranes with oxygen entering the bloodstream and carbon dioxide exiting. It is through this mechanism that blood is oxygenated and carbon dioxide, the waste product of cellular respiration, is removed from the body. The major organs of the respiratory system function primarily to provide oxygen to body tissues for cellular respiration, remove the waste product, carbon dioxide, and help maintain acid-base balance. Portions of the respiratory system are also used for non-vital functions such as sensing odors, speech production, and for straining, such as during childbirth or coughing. Functionally, the respiratory system can be divided into a conducting zone and a respiratory zone. The conducting zone of the respiratory system includes the organs and structures not directly involved in gas exchange. The gas exchange occurs in the respiratory zone. Conducting zone. The major functions of the conducting zone are to provide a route for incoming and outgoing air, remove debris and pathogens from the incoming air, and warm and humidify the incoming air. Several structures within the conducting zone perform other functions as well. The epithelium of the nasal passages, for example, is essential to sensing odors, and the bronchial epithelium that lines the lungs can metabolize some airborne carcinogens. The cilia of the respiratory epithelium help remove the mucus and debris from the nasal cavity with a constant beating motion, thus sweeping materials toward the throat to be swallowed. Interestingly, cold air slows the movement of the cilia, resulting in the accumulation of mucus that may in turn lead to a runny nose during cold weather. This moist epithelium functions to warm and humidify incoming air. Capillaries located just beneath the nasal epithelium warm the air by convection. The bronchial tree. The trachea branches into the right and left primary bronchi at the carina. The bronchial tree, or respiratory tree, is the collective term used for these multiple branched bronchi. The main function of the bronchi, like other conducting zone structures, is to provide a passageway for air to move in and to and out of each lung. In addition, the mucous membrane traps debris and pathogens. A bronchiole branches from the tertiary bronchi. Bronchioles, which are about 1 millimeter in diameter, further branch until they become the tiny terminal bronchioles, which lead to the structures of gas exchange. There are more than 1,000 terminal bronchioles in each lung. The muscular walls of the bronchioles do not contain cartilage like those of the bronchi. This muscular wall can change the size of the tubing to increase or decrease airflow through the tube. In contrast to the conducting zone, the respiratory zone includes structures that are directly involved in gas exchange. The respiratory zone begins where the terminal bronchioles join a respiratory bronchiole, the smallest type of bronchiole, which then leads to an alveolar duct opening into a cluster of alveoli. Alveoli. The alveolar duct is a tube composed of smooth muscle and connective tissue, which opens into a cluster of alveoli. An alveolus is one of the many small grape-like sacs that are attached to the alveolar ducts. An alveolar sac is a cluster of many individual alveoli that are responsible for gas exchange. Respiratory rate and control of ventilation. Breathing usually occurs without thought, although at times you can consciously control it, such as when you swim underwater, sing a song, or blow bubbles. The respiratory rate is the total number of breaths or respiratory cycles that occur each minute. Respiratory rate can be an important indicator of disease, as the rate may increase or decrease during an illness. The respiratory rate is controlled by the respiratory center located within the medulla oblongata in the brain, which responds primarily to changes in carbon dioxide, oxygen, and pH levels in the blood. The normal respiratory rate of a child decreases from birth to adolescence. A child under 1 year of age has a normal respiratory rate between 30 and 60 breaths per minute. But by the time a child is about 10 years old, the normal rate is closer to 18 to 30. By adolescence, the normal respiratory rate is similar to that of adults, 12 to 15 breaths per minute. Neurons that stimulate the muscles of the respiratory system are responsible for controlling and regulating pulmonary ventilation. The major brain centers involved in pulmonary ventilation are the medulla oblongata and the pontine respiratory group. Diseases of the respiratory system. Allergies. Allergies occur when your immune system reacts to a foreign substance such as pollen, bee venom, pet dander, or food that doesn't cause a reaction in most people. Your immune system produces substances known as antibodies. When you have allergies, your immune system makes antibodies that identify a particular allergen as harmful, even though it isn't. When you come into contact with the allergen, your immune system's reaction can inflame your skin, sinuses, airways, or digestive system. The severity of allergies varies from person to person and can range from minor irritation to a potentially life-threatening emergency. While most allergies can't be cured, treatments can help relieve allergy symptoms.